calling and mission and principles of being a doctor.
It will be unethical and it will be against the principles of being a doctor if we don't strike, okay? Let's be clear about this. Firstly, a lot of people have this perception that there will be no doctors on the days that doctors strike. This is not the case. Only junior doctors are striking, so there will be lots of other non-junior doctors who will be covering those services. Doctors have never put patient safety at risk, and they never will, and that will not happen on the days of the strike. Yes, there will be logistical disruption.
Junior doctors form the vast majority.
Absolutely, but there are several non-junior doctors, like myself, for example, who will be covering them. So there will be no risk to patient safety, and there never has been. Research has been done on all strike action that doctors have taken between 1976 and 2003, and it is clear that mortality does not increase. So that is simply scientifically incorrect.
Is that because operations are cancelled?
There are a number of reasons for it. That may be one of them. There is really a whole plethora of reasons. And the second thing to emphasize is that if we want the NHS to survive, and if we want an NHS where patients are treated safely, then it's absolutely essential that we oppose this junior contract, because it will create an NHS where doctors are overworked and exhausted, and that will put patients' lives at risk. And if we continue to bleed doctors, if doctors continue emigrating as a result of the pressures, so for example, a third of the entire A&E workforce has emigrated in the last 5 years, about 10,000 GPs are applying to work abroad every year. If that keeps happening, and if we have fewer and fewer doctors, the NHS will not survive. So it's our absolute duty to carry out this.
Okay, audience in a minute, find out what you think about this.
I just want to clarify, you are asserting right now on live TV that when this strike happens and when the junior doctors leave, you don't think a single patient will be put at risk? You don't think there will be a single patient whose health and whose life is put at risk?
I just
want to be clear about that, because that's what was just asserted, and that's outrageous. That's not true.
I am going by the evidence. As an academic, I have looked at the evidence, and it is clear that mortality does not increase with the strike because of all of the precautions that take place.
And could we move beyond the soundbite aspect of this? Could we please do that? Because
10, 12
I'm
days
here.
time, we'll find out.
Professor Beresford,
I'm here today as a social policy academic, but I also speak as someone with long-term experience as a user of the NHS, but of the least desirable, often considered aspects of the NHS, that's to say mental health services. And I have to be honest and say quite simply to you, who do I put more reliance and trust on, the professionals I've worked with or people who work with unaccountable think tanks? But let's get down to basics here. What we are always talking about when we're talking about the NHS you describe as a monopoly, a loved public service, what we're talking about is a relationship. It's the key relationship between us, people, and doctors, or it could be social workers, or it could be nurses. A very personal, often intimate and sensitive relationship. But there's another party, always in this relationship, which sets the tenor, which provides the structure, which makes possible the operation of a system. And that, of course, is policy makers and politicians. And politicians have their own preoccupations, their own political party concerns, and I suspect, looking at the fact we haven't had such a strike for more than 40 years, that that's the real problem here. So please, can we really get down to the basics, which is who, in the event of a problem, would you trust as someone requiring help, a politician or a junior doctor?
Okay.